depression and anxiety are different conditions, but they commonly occur together. They also have similar treatments. Feeling down or having a blues now and then is normal. And everyone feels anxious from time to time. It's a normal response to stressful situations. But severe or ongoing feelings of depression and anxiety can be a sign of an underlying mental health disorder. Anxiety may occur as a symptom of clinical, major, depression. It's also common to have depression that's triggered by an anxiety disorder, such as generalized anxiety disorder, panic disorder or separation anxiety disorder. Many people have a diagnosis of both an anxiety disorder and clinical depression. Symptoms of both conditions usually improve with psychological counseling, psychotherapy, medications, such as antidepressants, or both. Lifestyle changes, such as improving sleep habits, increasing social support, using stress reduction techniques or getting regular exercise, also may help. Being depressed often makes us anxious, and anxiety often makes us depressed. If you have either condition, avoid alcohol, smoking and recreational drugs. They can make both conditions worse and interfere with treatment. What causes anxiety? For reasons that are only partly understood today, the fight or flight center in these individuals' brains becomes activated, even when no real threat exists. Being in a state of constant anxiety is like being stalked by an invisible predator. The feeling of being in danger never goes away. They are always on alert. Occasional anxiety is a normal part of life. It's common for people to feel anxious if there's conflict in a relationship, a problem at work, a big test looming or a major decision dead ahead. But anxiety disorders involve more than temporary worry or fear. For people with an anxiety disorder, the anxiety does not go away. It often gets worse over time to the point where feelings interfere with their daily functions. What causes depression? Current research suggests that depression is caused by a combination of genetic, biological, environmental and psychological factors. While it may occur at any age, it often begins in adulthood. As with many anxiety disorders, depression in children and adolescents may present itself as irritability more than low mood. By adulthood, depression shows up as hopelessness, despair and anger. With a low energy level, afflicted individuals often feel overwhelmed by the day-to-day tasks and personal relationships fundamental to life. What strategies are often used in treating this dual diagnosis? Evidence-based research suggests that both anxiety and depression be treated at the same time. Cognitive behavioral therapy, CBT is often used to treat people with both disorders. Fears, anxieties and tendencies toward depression are managed by seeking out their root causes. Once uncovered, patients learn how to take control of their emotions and life. Antidepressant medications, often combined with CBT, these may be prescribed in treating both disorders. Selective serotonin reuptake inhibitors, SSRIs, are new antidepressant drugs that produce fewer side effects than their predecessors. Exercise, this can be very helpful for both disorders. Physical activity causes feel-good chemicals to be released in the body. This aids in relaxation and feeling of well-being. Relaxation techniques, this typically involves meditation or mindfulness. These techniques can often help to remedy both disorders and improve quality of life. Interpersonal psychotherapy, IPT focuses on the connection between onset of symptoms and current interpersonal problems, such as unresolved grief, relationship disputes, and social isolation or withdrawal. Managing anxiety and depression. A therapist can offer more guidance on treatment options for anxiety and depression, but you can also take steps to cope with symptoms on your own. Trying different approaches at different times can help you learn more about what works for you. That insight can guide you toward a personalized toolbox of coping strategies, so you always have options to consider when feeling distressed or overwhelmed. Your therapist can also offer suggestions for new strategies to try, plus offer tips on putting them into practice. Allow yourself to feel what you're feeling. Depression and anxiety are medical conditions, not the result of failure or weakness, and they're absolutely not your fault. Without a doubt, the unwanted emotions they cause can lead to plenty of distress. But knowing depression and anxiety result from underlying causes and triggers, not anything you did or didn't do, can promote self-compassion instead of criticism or self-punishment. Do something you have control over. Regaining some control in the moment could help overwhelming feelings feel a little easier to cope with. You don't have to take any major action, but accomplishing a short task, such as making your bed, taking a shower, or unloading the dishwasher, can help boost a sense of accomplishment. It could also offer a temporary distraction. Aim to get a good night's sleep. Not enough sleep can worsen symptoms of both anxiety and depression, but too much sleep can also affect well-being and mood. Experts recommend most adults get between 7 and 9 hours trusted source of sleep each night for optimal health. Reach out to loved ones. Strong relationships can go a long way toward improving your outlook and emotional well-being when you live with mental health conditions. Simply knowing you have someone you trust in your life can often help you feel less alone, whether you actually want to talk about your symptoms or not. Finally, anxiety and depression can feel overwhelming, especially when you live with both conditions, or aren't exactly sure which condition you're dealing with. But you don't have to manage those symptoms alone. Getting support for distress that lasts more than a few days or begins to affect your daily life can go a long way toward helping you find relief. Leave your comment below about our video, we will appreciate that. Thanks for watching.